Expert opinions, trusted insights.
This is Eye Surgery Today,
an insider's guide to vision correction
from 4 of the nation's leading eye surgeons.
All right, Gary, so now patients come in for their consultation and we're taking a scan of their eye called biometry. What is that?
I think biometry is probably the most critical test that we do on our cataract patients. Biometry really means we're measuring the corneal curvature and the internal structures of the eye, meaning where does the lens of the eye or the cataract of the eye sit in the eye in position relative to the cornea? How long is the eye? All of these measurements go into these AI or algebraic formulas to determine, once we take out the cataract and we put in a new lens, what powered lens will give the desired outcome. And so there is some chaos theory in this where we cannot 100% predict which lens is going to give the outcome that we want. And that's a little bit frustrating for patients and it's frustrating for us. But there's some inherent variability. I generally will tell patients that we can usually hit our target upwards of 80% of the time within a half a diopter. That's where light adjustable lens is a little bit of, it's a big benefit to us, because if we are off a little bit, we have the chance to fine tune things. But I say that biometry is a lot like meteorology. Okay, so you've got storm fronts that are coming across the country. You've got high pressure systems and low pressure systems. You've got moisture and dew point and all these things. And the meteorologists who predict the weather put all these things together and tell you whether it's going to rain or not. But we've all been on a parade and it's rained when it's not supposed to, or it's rained on our picnic. And so, all the formulas are fantastic. They get better and better. They keep improving, especially with AI. They're getting better. But it ultimately comes down to the quality of your tear film, the technology that's being used, the actual surgical outcome is important, but the way your eye heals is really individualized. And so sometimes when we end up having a patient who's a little more farsighted or nearsighted or ends up with a little more astigmatism than we had planned, it's really just because that eye has healed in a way that the formula wasn't able to predict. And again, not your fault, not our fault. And there are ways to correct that, either with an enhancement like laser vision correction or changing the lens out. So biometry is a crucial point in your consultation. That's why we want your ocular surface optimized. And it's those numbers that are generated that will help us make a determination for what lens implant to implant.
Yeah, most definitely. And there's assumptions that are made in those algebraic calculations that you were describing. And some of them is where the lens lands or sits after the healing of the eye, or how the cornea heals and how the incision that we make in the cornea actually heals and what impact that has, and the ocular surface and all of those things. And we've gotten better and better at making those predictions based on the nomograms we have and the calculations. Biometers have become better. Also using laser, for example, and aligning the lens, toric lenses or astigmatic correcting lenses perfectly aligned on the astigmatism of the patient allows us to then give them the better outcomes that we hope for, or creating the opening in the capsule where the lens sits in with a laser that's perfectly centered. So all of these things can really help us fine-tune the results for our patients. I also want to highlight that patients are very confused by that, because they think their prescription for their glasses is what defines what lens power we put in the eye. And they're worried because they say, well, but my prescription keeps changing and I'm not sure if I said what's better, 1 or 2. It has nothing to do with the what's better, 1 or 2, as far as what lens power we choose for our patients. And it's important for them to understand that the measurement of the lens power is really mostly dependent on the anatomical measurement of the optical system of the eye.
Yeah, I think for our viewers, they should know that Gary is the perfect person to be talking about this, because he has developed his own nomogram, actually. So as somebody who I would consider an expert in our field in lens calculations, even that it's not the surgeon, it's a limitation of not even technology, really. It's just a limitation of an ability to predict human healing, because human healing is a little bit unpredictable. And so I think there's varying degrees to how unpredictable that can be. So I've heard anywhere between 80 and 90% is the best we can do with a fixed power lens, meaning 10 to 20% of the time, if you pick a fixed power lens, as amazing as that lens is going to be, there will be some residual prescription that we need to correct if you want your most optimized vision with either glasses, contacts, or a laser vision correction enhancement or a lens exchange. So some patients aren't going to be good candidates for that enhancement, or in some cases, there's actually more margin of error. Like let's say somebody who's had previous refractive surgery, like LASIK or PRK, or somebody who has a really long eye or a really short eye. I find myself strongly recommending light adjustable lens for those patients because in our own practice, we've analyzed our data and we're over 95% accurate for those patients with light adjustable lens. And so your surgeon may guide you towards an adjustable lens if there's something about your eye that makes your calculations more complex.
Yeah, and as ophthalmologists, we're perfectionists. And so we're talking about hitting the target and being a little bit off and how the eye heals makes it more unpredictable. But for most of our viewers, our patients, that unpredictability, we may be off by half a diopter. What we talk about is 20 happy is important. Now, my dentist is a perfectionist too, and she's always coming at me saying, no, that's not perfect. And I say, I'm happy with what you've done. We don't need more. It's the same here too. So when we're talking about these nuanced measurements, great majority of patients land where they are going to be very happy. And if they're a little bit off from that, it doesn't mean it's not a successful outcome. It may mean that it needs a little bit of an enhancement. So in summary, biometry is a really important tool for cataract surgery and is what we really rely on in determining what power lens to put, to use for that specific patient. But there is a little bit of unpredictability, which we've been able to handle with our approach that we take to surgery.
Right. I think it's sort of a request for a little bit of grace, knowing that there are these inherent unpredictabilities. So if you have cataract surgery and the surgeon was good and used a lens that was predicted, if there is some level of blurriness afterwards, it wasn't because something nefarious was done. It's just there are some inherent limitations that we all are stuck with right now.
Yeah, and I'll share one small story to kind of drive home that point. I'm sure you've both experienced this in your practice. If I have a patient who has dry eye, I counsel them that we need to treat your ocular surface. We need to optimize your ocular surface to improve our accuracy with our measurements. And I also am one that if I'm concerned about something like that, I'll measure twice, 3 times if I need to. I'll repeat my biometry. I also repeat measurements in surgery using intraoperative aberrometry if I'm really concerned. And every once in a while, I have a patient like this right now. You aim for one thing, doing all of that, and you still end up off. And the patient comes in and they're like, wait, we aimed for near, but I can see distance. What's wrong? And I'm like, oh, well, remember that thing we talked about with your dry eye? That's why we're off. And the good news is there's ways to fix it, but just know that probably wasn't a mistake on your surgeon's part. It was something that's just unpredictable human healing or difficulty measuring an eye that's dry. It's all kind of part of the process.